Hello everyone. Today we will be discussing how to prepare topical interferon eye drops for use in treating ocular surface squamous neoplasia, also known as OSSN. So this presentation is divided into four parts: introduction, the equipment required to prepare topical interferon eye drops, how to prepare the eye drops, and the precautions which need to be taken while dispensing them. So to begin with, interferon alpha is a glycoprotein which has been noted to have anti-neoplastic and antiviral properties. Now, interferon alpha 2 beta, which is the molecule of interest here, is a recombinant form of interferon alpha and has been found to be highly effective in the treatment of OSSN. The main benefit of using topical interferon is that there is a high frequency of resolution as well as a favorable side effect profile. An example of this is shown here. So this is an elderly gentleman who presented to my clinic last year. So he had an OSSN in his right eye, as can be seen here on the picture on the right side. Please note the scalloped margins as well as the feeder vessel at the top. We started him on topical interferon based on clinical suspicion as well as the anterior segment OCT findings. And this is the result after 2 months of topical interferon. On the right side, you can see the same eye where the OSSN has completely regressed. So this is the magic which topical interferon can have. And additionally, it is very gentle on the. So now we come to the meat of the matter. How to prepare the eye drops. For this, you will require 2 vials of interferon alpha 2B injection, 3 million international units per 0.5 ml, as shown in the photo here. So I prefer to use Reliferon, which is marketed by Reliance Life Sciences, and I have had good results with it. There is no financial interest here. Second is you need a 5 ml syringe with a needle, and you need a 10 ml vial of lubricant. For example, Refresh Tears or any other lubricant will do. It is very important that once you obtain the interferon vial, it has to be stored in the fridge. Cold chain maintenance is absolutely necessary here, and it is preferable that you store it in the door of the fridge. Additionally, it is of importance to note that Reliferon is indicated for subcut or IM use only as per the packaging. However, we use it on an off-label basis for treating OSSN. So how do we reconstitute the interferon? First, you have to discard 5 ml of lubricant from the 10 ml vial using the syringe. Next, you have to draw interferon from both the vials into the syringe. So this will give you 1 ml of interferon in total, or 6 million international units of the same. So now you have 6 million units of interferon in 1 ml in your syringe and 5 ml of remaining lubricant in the lubricant vial. Now you simply inject the 1 ml of interferon into the remaining 5 ml of the lubricant vial. This gives you 6 million units in 6 ml. Hence, a concentration of 1 million international units per ml of interferon alpha 2 beta is achieved. So what are the precautions which need to be taken here? First and foremost, the cold chain must be maintained. I dispense topical interferon eye drops in an ice box to the patient, and I tell him to take the ice box immediately to his home and keep the drop in the door of the fridge. Second, 1 vial of reconstituted interferon can be used for 1 month. The drop needs to be discarded after a month and fresh reconstituted drops are dispensed. Next, for the treatment regimen, 1 million units per ml, the concentration which we achieved in the previous slide, is prescribed for the patient at a dosing of 4 times per day. Side effect profile is quite good for interferon. You may have mild hyperemia or mild pain, but these are usually transient. Tearing or photophobia may occur, but these are exceedingly rare side effects of interferon. I prefer to continue topical interferon drops for at least another 3 months after complete tumor regression. This is because there might be micro seeding or micro residues of the tumor left which are not visible to the naked eye. So as shown in the color photograph here, so this photo is taken from one of my own publications on management of OSSN using interferon. So this gentleman was kept on interferon for another 3 months after regression of the tumor. The tumor regressed within 2 months. So in total, he received 5 months of topical interferon therapy. If you look closely, you may recognize that this clinical picture is the same as that which I had shown in the beginning of the presentation. So this is all from my side for today. I hope that this presentation is useful, especially for those looking to reconstitute topical interferon drops for their patients. Thank you for your valuable time. This is where I work, and these are my contact details. Please don't hesitate to get in touch.